to Jose, because it sounds like you'll have to get involved with the implementation of something like that, and certainly do it securely, and all these other things that have to be thought about when implementing a system across the country like that.
Yeah, I mean, so first of all, it is an unbelievable goal. I think I'll talk about something that we've built since April 5th. And so as it relates to the coronavirus response, and I think it dovetails nicely into Mark's comments. One of the challenges we have across the United States in responding to this pandemic is a lack of visibility into and a common operating picture in terms of what's happening on the ground across the US. And so on April 5th, we were given a proof of concept that was a very small proof of concept that was invested in by CDC. And we've gone forth and actually built something that we call HHS Protect. We launched it on April 10th. HHS Protect is focused on protecting people, protecting transparency, protecting privacy, protecting security, and finally protecting integrity and data sharing. The platform itself, by April 28th, we had 2.5 billion data elements in it. We had data that we're receiving data from all 50 states and all 6 territories. We're sharing data with all 50 states and all 6 territories. We currently have about 4 billion data elements in it. The data elements include data directly submitted to us from around 5,800 hospitals across the United States, all of the single sources of truth for case reporting. And we have a diagnostic dashboard, and we have almost all the lab testing that exists across the United States. Direct interface daily feeds into it. And we can look at a common operating picture across the United States as it relates to coronavirus at the federal level, at the state level, at the county level, and at the zip code level. Now we can get an understanding how the virus itself is impacting different people. Now our approach, and I'm going to tie it back to kind of what Mark said, our approach has been to actually take commercial technologies, Lou, and instead of hiring an integrator, actually be the integrator and integrate those technologies to deliver the solution. So we have a modern identity access management capability. We have a modern secure file transfer capability. We have a platform that allows for parsing, curation, and sharing with integrity. It's underlined by a hash. It has a time series capability. So when we opened it up to states and one of the states mentioned that we were manipulating numbers, I went back in time through my immutable hash and I said, it looks like you guys actually submitted the same data set twice within 2 minutes and you backdated one of them. Not sure why you did that, but this is immutable. This is the single source of truth. We're running, we overlaid it with mapping technology and ability to sign and agree to digital agreements. We have about 20 DUAs with private sector commercial companies that are providing insights on the medical distribution network as it relates to coronavirus across the United States. We're running a supervised machine learning capability off the 4 billion data elements to actually predict hotspot outbreaks across the United States so that we can run clinical trials more efficiently, to distribute remdesivir across the United States to help the American people, and to distribute lab testing across the United States. So we put that in place, started on April 10th. The numbers I just gave you is where we are at this time. One of the things that we did recently within the last 2 weeks to kind of get to Mark's point is we actually stood up a public-private key infrastructure. And what we've done is we've created the ability for an organization, like a company, to have a digital identity, government to have a digital identity, an endpoint, whether it's a sensor or a machine, think of an over-the-counter COVID-19 test at CVS, to actually have a digital identity so that we can build an application ecosystem leveraging the data in HHS Protect and leveraging the test results so that an individual consumer can actually keep their test result on their phone, time-stamped, anonymized, in an immutable way, updated at the federal, state level, directly from an over-the-counter CVS test, and then use the data in HHS Protect so when they're driving down I-95, they can figure out where they should stop to go to the bathroom based on case counts, based on zip codes, based on a live stream API of that data. We think that modernizes the healthcare industry. We think this pandemic in and of itself is a fundamental shift for the industry. Why? We need 1.5 million people are going to have to enroll in clinical trials. We have a clinical registry. We have about 500,000 people signed up. We need people to register for vaccines. We probably are going to have to vaccinate 330 million people. If only half of them actually choose to get the vaccination, you've just created a digital identity for 170 million people across the United States and given them the ability to store the record of their vaccination on a mobile device.
Pretty incredible.